From 2016 to 2017, the reported cases of syphilis increased by an astounding 10.5%. From 2013 to 2017, that same rate is 72.7%. Now, this came after 65 years of nearly steady decline in cases since the 1940s, when penicillin became available and widely used. Now, I know there's at least one person in this audience who is thinking, Dr. Voltaggio, why are you rehashing this subject? You did this lecture a couple of years ago. Who cares? Well, this is why. This is a press release from the CDC from October 8th from this year, and where it says that combined cases of chlamydia, gonorrhea, and syphilis have reached an all-time high. So this is why I'm rehashing this subject. So what are we going to do today? So today, I would like to summarize the national epidemiologic trends as they relate to sexually transmitted infections. I want to identify or tell you which are the populations that are most at risk. I would like to discuss features of patients with STI of the aerodigestive tract, so not only GI, but also in the buccal mucosa, or recognize patterns of inflammation associated with STIs, which are more than one. Now, I grew up knowing these as STDs. Why are you changing these to STI now? So STI does not have the connotation, stigma, and shame that STD has acquired during the years. So that's one thing. The other thing is that when you use the word disease, it conveys an actual medical problem, a patient with symptoms, signs and symptoms of disease, whereas infection, an infected patient may or may not have symptoms. For example, an asymptomatic woman with chlamydia or gonorrhea has an STI, whereas a woman who develops a pelvic inflammatory disease, has disease. Now, who are the patients at risk? Most of the affected patients are males, of whom the vast majority are men who report having sex with men. Now, the rates of infection in women have increased a little bit over the years, but those account only 12% of the cases. Well, let me just change this pointer. Just 12% of the cases. Infection in women and in men who have sex with women, interestingly, does not relate to sexual behavior, and instead it relates to self-reported injection drug use, raising the possibility of a potential parental mode of transmission for syphilis. Now, rates have been increasing in all races and Hispanic ethnicities, but from 2016 to 2017, the highest increase, which was about 40%, occurred in Native Americans and Alaska Natives, followed by people who identified as multiracial. In infected patients, there is a very high risk, a high incidence of HIV co-infection, but this is especially true for men who have sex with men. 45% of infected patients are co-infected with HIV, and that same number is 8.8% for men who report having sex with women, and only 4.5% for infected women. And now there's a very concerning trend in the past couple of years as it pertains to congenital syphilis. From 2014 to 2018, the cases of congenital syphilis have nearly tripled. And just between last year and this year, between 2017 and 2018, there has been a 40% increase in cases of congenital syphilis and a 22% increase in newborn deaths as a result of infection.